So today we're going to be talking about outcomes of acute versus subacute scapholunate ligament repairs. So for the overview, we're going to go through the background, methods, results, a conclusion, and then finally our take-home messages. So for some background, a scapholunate ligament repair, typically the mechanism of injury is a fouche, and then usually the surgery is direct ligament repair or an SLL repair with or without dorsal capsulodesis, which is recommended for patients with acute SLL tears, which means that the injury occurred less than 6 weeks from the time that they go to the doctor's office. And then that surgery consists of the scaphoid and lunate bones are being brought back together to their normal alignment. K-wires are inserted to hold the bones together in place, and then the torn ligament is stitched together with suture anchors. Treatment for patients with subacute SLL tears, so those treated greater than 6 weeks after injury, typically consist of a dorsal capsulodesis, SLL reconstruction, or limited wrist arthrodesis. And dorsal capsulodesis is defined as tightening of the dorsal portion of the wrist capsule to stabilize the scaphoid and lunate bones. So this study in particular investigated the long-term outcomes of direct scapholunate repairs with or without dorsal capsulodesis performed within 6 weeks of a SLL tear versus 6 to 12 weeks following injury. So for some more background, it is currently unknown whether time from injury truly affects outcomes following the treatment of a SLL tear with direct repair or with direct repair and capsulodesis. Restoration of a ligamentous integrity is possible whenever sufficient ligamentous tissue is accessible, the scaphoid is reducible, and there's no arthritic degenerative changes observed. Short-term outcomes have demonstrated mixed results with eventual progression to scapholunate advanced collapse, also known as slack wrist in some patients. A type of wrist arthritis that can occur when the bones in the wrist wear down the cartilage, leading to osteoarthritis, is the definition of slack wrist. And in the picture on the left, you can see how those bones are just touching the radius and there's no cushion in between them. That's what happens when slack wrist is involved. So for the methods, there was a review of medical records from April of 1996 to April of 2012, which identified 24 patients who underwent this SLL repair. There was 12 acute and 12 subacute. Patients returned to the clinic for radiographic examination of the injured wrist, standardized physical examinations, and validated questionnaires. Patients were eligible for the study if they were treated for an isolated, complete rupture of the dorsal SLL and underwent SLL repair with or without supplementary capsulodesis. Patients were excluded from the study if they had a concomitant carpal or radius fracture, an additional complete carpal ligamentous injury, or evidence of slack wrist arthrosis prior to the SLL repair. For some results, the mean follow-up times for acute and subacute groups were 7.2 and 6.2 years respectively. At the final examination, patients with acute surgery regained more wrist extension. Acute was about 55 degrees, where subacute was about 47 degrees. The total wrist flexion extension arcs, grip strengths, pinch strengths, and patient-rated outcome scores were found to be similar between the groups, and the final scapholunate gap, the scapholunate angle, and the prevalence of arthritis were also found to be similar between the acute and subacute groups. So in conclusion, although SLL repair is more commonly recommended for treatment of acute SLL injuries, there were no significant long-term differences between acute and subacute SLL surgeries, repair plus or minus the capsulodesis. So, for some take-home messages, as we've been learning all semester, there is some cognitive dissonance here because, like I said, there is really no difference between the two surgeries as a whole. So just making sure that you have great patient education and instruct your patient that either way they're probably going to have good outcomes is super important. However, making sure that there's a proper referral to be made to avoid slack wrist, because once slack wrist sets in, there's nothing you can really do about it, and since it's degenerative, it can cause arthrosis and other degenerative diseases. And it was shown that most of the people in this study, when they went to the doctor's office, slack wrist had already set in because they waited so long. And I think that that's also very important for our profession, that as athletic trainers, we see this type of injury and we are the first line of defense for these people. So making sure that we make a proper referral so we can avoid any type of slack wrist or degenerative changes, I think could really benefit our patients. So just making sure that we are good at patient educating and making sure that we give a comprehensive evaluation is super important. And here's my references. Thanks.